Hi, tourists. It's 7X right now. Right now, like big ass talking about right now, pancreatic cancer. Pancreatic cancer is a very deadly form of cancer. It's cancer of the pancreas, which is near the duodenum, and also the gallbladder, so and the liver. And basically, pancreatic cancer is divided into two types. Now, disclaimer: we're not a doctor, not giving medical advice. So, first off, you have exocrine pancreatic cancer, which comes from the ducts of the pancreas. Then you have neuroendocrine pancreatic cancer, which comes from cells that make insulin, so whatever types of cells. So then you have also other types like lymphoma, sarcoma, etc., etc. Most pancreatic cancer, about 90-95% pancreatic cancer, is exocrine, which comes from the ducts, and that's what people typically think about when they think about pancreatic cancer. Now, pancreatic cancer is unfortunately very hard to treat, and the reason being is because by the time it's diagnosed, usually it's spread to other parts of the body. In the early stages, there are no symptoms. Now, pancreatic cancer is most commonly caused by smoking. It can also be caused cigarette smoking. It can also be caused by other things such as obesity, heavy alcohol use, acute or chronic pancreatitis, other types of risk factors. But most commonly occurs in men, usually older men, usually men in their 60s, 70s, 80s, etc. Usually the older population. And pancreatic cancer, unfortunately, by the time it's diagnosed, is very hard to treat because there are so few symptoms in the early stages. So a lot of it revolves around palliative care and hospice and managing pain. So when it is found early, there is options like a Whipple procedure, such as removing part of the pancreas, etc., and radiation therapy, chemotherapy, etc. Aside from that, it's a very hard illness to cure, and probably about 5% of people survive pancreatic cancer for more than 5 years. Big ask to your life. Bye.